Welcome back. About 12 minutes before 7 o'clock. Sudden death due to cardiac arrest in young athletes generally doesn't come with warning signs. So what can be done to prevent such a tragedy? Here to try and answer that this morning from Gunderson Health System is Andrea Winters. Andrea, thanks for waking up with us this morning.
Good morning. Thank you for having me.
So we're talking about cardiac arrest in student athletes. Medically, what exactly happens when somebody undergoes this?
Well, we know there's several conditions, I guess, that we've identified that can put athletes at risk of having this rare but tragic event. And the most common is a thickened heart muscle condition called hypertrophic cardiomyopathy. And then after that, we think about infections of the heart muscle or an abnormality in the blood flow to the heart tissue in one of the major arteries, and then electrical conduction concerns that we can see with the heart too.
So do these, I know we talk about how it often comes up suddenly, no warning signs, but is there anything you can watch for if you are a parent or a friend of somebody that might be at risk for this?
Absolutely. That's where sports physicals come into play, really important. I urge families to go into their sports physicals well prepared. The athletes should be thoughtful and honest about any symptoms or limitations they might be experiencing. And families should be prepared to discuss their family health history, because that can give important clues as well to help us as providers know if this athlete might be at particular risk.
Do sports physicals always go far enough when it comes to concerns of the heart? I know in a normal yearly physical that I get lipid testing done, but and when I had sports physicals growing up, I didn't always get that. So is there something more that needs to be done?
Right, it's a good question, and it's a hot topic actually also. I would say the American Academy of Pediatrics has endorsed certain guidelines of what should be covered, and the American Heart Association has had 12 points that are considered in that as well, and it really does do a good job. Okay. These events, as tragic as they are actually rare, thankfully. It's just when it happens, it's devastating to a family and to an entire community, so we do hear about them. But I think when we go through a thorough sports physical, we do capture most of those cases. I think it gives us the clues or the findings on exam that would say, gosh, this is an athlete that could be at risk and warrants further testing. Okay, that's certainly good to know. Now, when somebody does collapse on the field, I know each situation is different, but what are the steps to take, to possibly save a life there? Absolutely. Well, being prepared ahead of time is the first key. The schools in our region in particular do a great job, but there needs to be automated defibrillators or AEDs in every school, on every field. They need to be accessible, and people need to know how to use them. And I think the schools and the coaches and the teachers, many of them are trained, but I think as community members, the steps are simple to learn. I think we could all easily learn how to do that. So if an event happens, people know how to take action quickly. All right, Andrea, thank you so much for sharing the details on this tragedy, but as you say, rare tragedy this morning. Yes, thankfully. Thank you for having me. Yes, and we'll head to break with a look at what's coming up on Good Morning America.